So, hello guys. So, today our video discussion is about a guide on blood specimen collection. So, what are you going to expect today? So, we will talk about microsampling and macrosampling in the collection of your blood. So, pag sinabi nating microsampling, it's about skin puncture or capillary puncture or peripheral blood collection, and we have macro sampling or venipuncture. Yan. So, but before that, syempre, you need to identify your patient. That's the number one most important thing that we do. We have to prepare your patient. Yun, we will discuss the how to troubleshoot during venipuncture, the complications, the different sites to avoid, the different equipments, and how to prepare your sample. When we say sample, either whole blood, serum preparation, and plasma preparation. So, grab your drink, grab your food, simulan na natin. Okay, so usually, so once you receive the request form and you're going to read what are the things that you are going, what are the tests that were requested by the doctor. So you will go now to your patient. So first the thing that you're going to do is identify your patient. So now we already have barcodes and barcodes on the rest of the patient. Actually, we also use barcodes as label in the specimen container. So every time class, so ito yung pinakamalaga ha, most important thing that we do in the laboratory before phlebotomy is patient identification, positive patient identification. Because guys, our tests, your skill in phlebotomy will be negated. Yan, mawawala lahat itong mga ito kung sa maling pasyente mo naman ang kinuhanan ang dugo or sa maling pasyente galing ang specimen. So, patient identification, guys, is very important. I cannot even stress it enough. How? In patient identification, you will always need two identifiers, meaning two ways to identify the patient. Yan. So, how do we identify the patient? By first asking their name. Ma'am, what's your complete name? Yan. What's your complete name? Please do not simply just ask the last name. Do not simply ask the first name. What's your complete name, ma'am? Yan. So, you never ask, ikaw po ba si Ma'am Angeli? Ganyan. Ikaw po ba si Sir Patrick? Ganyan. We don't do that. Why? Because sometimes, guys, some patients are not alert. Meron talaga mga pasyente na tango lang ng tango. Or sometimes, if they don't understand you, they nod. So class, the best way to identify them is they will always tell their name. Yan. So not only their name, kasi nga two identifiers, perhaps their birthday as well. Yan. Or their address. Yan. So if the patient is unconscious, please ask the nurse in the station, yan, the attending nurse, the attending doctor, what's the name of the patient, and ask the relative, and ask them the complete name, yan, and allow them to confirm for you, yan. So example, so if they are unconscious, they are sleeping, or if they are burnt patients, yan, you ask through the nurse or the physician. So, pag completely burnt yung pasyente, class, or pediatric, yung mga batang pasyente, you ask to the parent, to the guardian, to the nurse, yan. So, guys, actually, sometimes, yan, we could use the hospital ID bracelet, but our first priority is always ask the patient and ask the nurse, yan. And we compare it to the bracelet of the patient. Yan. We don't use the name of the patient on the door, yung nakalagay sa door. Hindi natin ginagamit yun as identifier. We don't rely on that. Yan. So class, every time we do venipuncture, there are so many physiological factors that could affect the results of our test. Yan. Example, posture. So if the patient got extracted and they were standing up for a very long time, there could be changes in posture. If they're lying down, yan, may changes in the proteins, actually even fats. What else? Diurnal rhythm. So class, every time that you're going to um, to extract in the morning, the highest analytes you'll expect are your ACTH, yan, adenocorticotropic hormone, and cortisol. So expect that ACTH and cortisol are low in the afternoon. And during afternoon, the ones at high, the type of WBC that's high is eosinophil during the afternoon. Yan. Stress class, so WBC, fibrinogen, cortisol also increases during stress. Exercise, yung mga muscle enzyme natin, creatine kinase, aldolase, creatinine, WBC count. Diet, especially after a fatty meal, we have alkaline phosphatase isoenzyme, which is intestinal isoenzyme. We have hemoglobin, um, so if it's a fatty meal, yan, it could cyan methemoglobin could be affected by fatty meal. Yan. So yon. Cyan methemoglobin is a test for hemoglobin, and smoking class WBC, cortisol, and carboxy hemoglobin. So class, just a few reminders that these are the common errors in specimen collection. So as much as possible, we want to prevent this one. Number one, top one class, misidentification of patients. So ang rami ng medtech class na nagkakamali dahil sa misidentification of specimen. Identification of patients. Example is yun, just asking the last name. Yan. So you're going to ask someone, ikaw po ba si Miss De La Cruz, ganyan, or Mrs. De La Cruz, ganyan. And nag-yes naman yung isa, yan, hindi natin alam yung nanay pala, 'di ba? Mrs. De La Cruz rin siya. So mga ganung bagay, guys. Number 2, mislabeling of specimen. Yan. So usually class, when we label a specimen, we do it after collection, okay? After blood collection, that's the only time we label the specimen. We write the name. If not the name, we place the barcode sticker after the specimen collection. Okay? We don't do it before specimen collection, but after specimen collection. Yeah, right after you've collected it, label it. Yeah. So number 3, short draws so when we do short draws, meaning you have not collected enough blood, yan. So the effect is there would be a wrong anticoagulant and blood ratio. So example, you use a lavender top which has EDTA. If you did short draws, so you extracted less than the required volume, example, less than 2 ml, class, excess EDTA could shrink your red blood cells. Yan, pwedeng niyang i-shrink yung red blood cell kung konti yung draw mo, especially if it's an EDTA anticoagulant. Yan. So, problema yon. So, class, kung short draw or minimal lang yung volume na nakuha nyo, you need to draw again. Number 4, mixing problems or clots. So, if you're not mixing enough, yan, 8, ganyan. Yan, pag ganun. Yan. So, make sure that, gentle inversion lang. Yan. Wala akong ano. Yan. So, if this is the tube, yan, gentle inversion lang. So, mixing problems or clots. So, you have to mix it properly. We don't mix like that. Yan, wrong tubes and wrong anticoagulant. So, you have to know, you have to read what test they are requesting. Yan. And actually, when you read the test that they are requesting, there's no indicated tube. Ikaw, medtech, magde-decide kung anong tube. So, you have to memorize. Kung, kunyari, ang test, APTT, PT, activated partial thromboplastin time. So, these are coagulation tests. So, pag coagulation test class, citrate tube, yung light blue. Yan. So, hemolysis or lipemia, yan, my teacher said hemolysis is a cardinal sin. You have to repeat your phlebotomy if there is hemolysis. Ulitin mo. Lipemia, so if there's excess fat. When there's lipemia, we don't repeat it, but depending on the test. Yan. Number 7, hemoconcentration from prolonged tourniquet application. So, the tourniquet application should only be done less than 1 minute. Yan. So, or else, magkakaroon ng hemoconcentration. Number 8, exposure to light or extreme temperatures. So, bilirubin tests. So, samples for bilirubin tests, they shouldn't be exposed to light. Hence, cover them with carbon paper. So, ayun class, kung na-expose na sa light yung blood specimen that's supposed to be for bilirubin, you have to repeat it again. Yan. Special example, if it's a specimen from a neonate or a baby, yan, ang hiling nila nagpapabilirubin test, mas lalo na pag lumabas na dilaw yung baby. So, ayun, class, if it was exposed, nako, you have to repeat the extraction again. At ang hirap pa naman kuhanan ng baby, and they're very prone to iatrogenic anemia. Yan, let's talk about iatrogenic anemia later. We have improperly timed specimen. Yan. So, example, fasting. So, class, fasting should only last from 8 to 12 hours. Yan, 8 to 12 hours. So, anything more than that, guys, it's over fasting. So, actually, hindi na yun tama. However, class, literature says that cholesterol testing, yung lipid profile testing, it could be tested for 8 to 14 hours yung fasting. Yan, 8 to 14 hours. Pero pag glucose, 12 hours lang. So yan, 10, processing errors, incomplete centrifugation, incorrect login, improper storage. So reasons for rejecting the specimen, there is hemolysis, lipemia, hindi masyado. Pero sabi ni Henry, clots present in anticoagulant specimen. So if you did not mix it properly, or perhaps you place excess blood, so yung anticoagulant blood ratio, masyado nang marami yung blood, tuloy hindi na gumana, nag-clot na. Non-fasting specimen which requires fasting, improper blood collection tube, short draws, improper transport conditions, eyes for blood gases. Yan. So when you're arterial puncture class, arterial blood is usually used for blood gases and it should be placed in ice upon transport. So kung walang ice, you have to reject the blood gas specimen. Discrepancies between requisition and specimen label. So if the request form, the name in the request form does not match the specimen label, then you have to ask the nurse. Hindi mo itatapon yung specimen. You have to confirm kung sinong gumawa nun. Yan, sinong gumawa nun, ganyan. You have to settle the discrepancies. We have unlabeled or mislabeled specimen ako. Contaminated specimen or leaking container. Alanganin tong mga to. Yan. So, best pag nagli-leak is, you have to recollect. Huwag ka masasayangan. So, when you're unsure, recollect na lang, guys. That's my advice. When unsure, recollect. Don't do anything. Okay. So, our sources of blood specimen are capillaries, arteries, and veins. So, in skin puncture, syempre, ang source natin are capillaries. Yan. So, and pag venipuncture is veins. Yan nga, venipuncture nga. So, arterial puncture class is usually performed now by respiratory therapists, especially if the hospital is big. Yan. So, respiratory therapists are the one who performs arterial puncture. But class, in the US, my friend, she performs arterial puncture. Depends on the SOP of the hospital. So let's start with microsampling. So when we perform skin puncture, yan, we don't, when we get blood from your capillaries, yan, hindi lang yung capillaries ang tinutumbok natin eh. So the blood in your capillaries are a mixture of venous blood, arterial blood, and tissue fluid or tissue juice. So, fluid that are coming from the injured tissues. Yan. So, class, the difference from venous specimen, so yung capillary blood natin usually has lower amount of hemoglobin, hematocrit, lower levels of red blood cell, and platelet count. Medyo mas mababa ng konti. However, higher WBC count due to chemotaxis from the cell injury. Sorry guys. Okay. So class, sinong mga skin puncture natin? Kanino siya? It's definitely not the best. Yan. But it's the best for infants. Class, it's good. Yan, skin puncture is good for young children if only small amount is needed or if they have if it's difficult to get acquired blood from them, and adults who were burnt, who had chemotherapy, ganyan. Meron yung mga adults who had shock, yan, wala ka na makuha sa wala ko na makuha sa ano nila, sa mga blood vessel nila. Yan, perhaps meron pa sa ano, capillary, blood vessels sa veins nila. Yan. So class, microsampling or skin puncture is good for infants. Yan. Because as much as possible, we don't do that. We don't want to get so much volume of blood from them because we might cause iatrogenic anemia. So iatrogenic anemia happens. These are complications or adverse results of frequent removal of blood samples. Yan. Actually, ang ibig sabihin nga ng iatrogenic is medical cost. Yan, or physician cost. Yan, cost complication. So, iatrogenic anemia is caused by the physician or medical treatment or the medical diagnosis. Yan. So as much as possible, we want to prevent iatrogenic anemia. So, kung konti lang naman, why not do skin puncture? Walang masama doon. Yan. Sites of skin puncture. So, when it's an infant, we puncture the heel of the foot. Yan. So that because if we will use fingers, guys, we might hurt the bones of the baby. Kaya sa heel of the foot, in the medial or lateral plantar surface. Mas maganda lateral. Yan. Tingnan natin. And if they are sites of skin puncture, pag older than 1 year old na class, medyo kasi naglalakad na, we could now use the third or fourth finger at least. We won't hurt the bone anymore. Margin of the lobe, which is very rare. I haven't done margin of the lobe yet. And length of the lancet is 1.75 millimeters only, or the depth. Yan. We don't puncture more than 2 millimeter. So, dapat less than 2 millimeter. Yan. So, class, we puncture in the medial or lateral surface of the heel. Ang suggest ko na lang, class, yan, lagi ng lateral. So, lateral is away from the midline. Yan. So, yan. Pero sabi niya middle or lateral. Pero kung ako sa inyo, lateral na lang. Yan. So, dito, yung mga highlighted area. Diyan. Yan. So, heel. Yan, pag infant. So, now, if they are 1 year old already, now we could puncture the third and fourth finger. Class, which the best side sa akin, ano na lang, fourth finger na lang. Fourth finger because it has less nerve endings. And I usually puncture the lateral sides. So, away from the midline, away from the thumb, dito sa side na to. And we puncture perpendicular or against the print, the fingerprint. So, kung pa ganyan yung fingerprint, dapat perpendicular or against the fingerprint. So, that across the grain of the skin. Yan. So, that it won't continuously leak. Yan, para hindi mag-pour out yung blood. So, mas maganda, perpendicular or across or against the fingerprint. Wag nyong yan, wag ganito. No, sabi niya. No. Ito, yes, yan, because it's across the fingerprint. Yan. So, we could use so many skin puncture. OSHA, CLSI recommend that the lancet should retract. Yan, dapat umaatras yung needle for it to be safe. Yan. So, pagkat press, dapat aatras yung needle para mas maging safe. According to CLS, yan. So, in your skin puncture, yan, you have to avoid inflamed, namamaga na nga, wag mo na tusukin. Okay? Cold and cyanotic. So, if you have warmer, ganyan, or if you have a warm towel, then please allow them to use it first. Congested and edematous area. So, class, when you're going to extract on edematous area, so most probably, tissue fluid na yung makukuha mo. Yan. So, yun, you have to repeat. So, find other areas which there is no accumulation of fluid under the tissue. Scarred and heavily calloused. Ayan. So, some people talaga, class, especially those who work in hard labor, yung ang kakapal talaga ng kalyo nila, tapos minsan ang dudumi pa talaga ng mga fingers nila. Yun. If you could do puncture, then venipuncture, then do it na lang. But kung kalyo man, yung nila, try finding other sites which are not calloused. So errors in skin puncture, excessive massaging. So or milking kasi nga you are pressing, you are increasing the amount of tissue fluid that's contaminating our blood. Excessive crying, yan, it could increase your WBC. Class, after puncturing the site, yan, remove the first drop of blood. Yan. So, removing the first drop of blood could remove the tissue fluid, remove the dead epidermal cells, and to facilitate free flow of blood. Yan. So, dito na tayo sa macro sampling. Yan. So, skin punctures has its own advantages. Class, advantages talaga ang skin puncture, especially among infants, among adults with who are burn patient, chemotherapy patient. But guys, yun, may advantage at disadvantage rin ng macro sampling. So what's good about venipuncture is you could multiple draw, you could get so many volumes of blood. It could allow repetition or follow up. There's less tissue fluid or tissue juices. It can be mailed because of the amount of volume. Pwede mong ipadala sa reference laboratory. Fastest method from a large number of patients. However, disadvantage is there can be complications. Yan. So because we are using a bigger needle, yan, we are extracting in a site where there are nerves around the area, there are arteries around the area, and it's difficult to do on some patients. Yan, burn patients, chemotherapy patients. Yeah. So, macro sampling, so yung mga equipment natin, tourniquet. So, tourniquet is used to distend the blood vessel, yan, or the vein. It is used to distend the blood vessel or the vein. So, class, wrong yung use ng tourniquet ha, to stop the blood flow. So, meron kasi yung sa QFR yung mga nagsagot ng ganon, tourniquet is to stop the bleeding, ganyan. So, yeah, tama naman. But what's the use of tourniquet in our context in the laboratory? Yan. We use antiseptic solution, usually alcohol. Yan. Sometimes iodine, the syringes, the needle, the evacuated tube, and the butterfly set. Yan. So the tourniquet, so it is usually placed here in the antecubital fossa. Yan, 3 to 4 inches above the site of puncture. Yan. 7.5 to 10 centimeter minsan nung lumalabas sa class sa board exam. So if there's no tourniquet, especially if we have an obese patient, hindi talaga kasya sa kanya yung tourniquet na maliliit, use a blood pressure cuff. Yan. Pero meron talaga yung obese talaga class na na hindi pwede yung isang blood pressure cuff. Dapat dalawa. So if you're going to use a blood pressure cuff, maintain a pressure of 40 to 60 only. Yan. Tapos yung mga antiseptic solution. So the needles that we use, so we measure the bore, the size of the bore of needles. Kung gaano kalaki yung diameter ng bore, we call it gauge. Yan. So the higher the gauge, the smaller the bore. Yan. The higher the gauge, the smaller the bore. So pag ako usually sa liit naman ng ng veins ko, talagang 25 gauge yung sa akin kasi ang liliit niya ng class ng veins ko. Normally what we use is 20G and 21G. Yan, ang sakit na din sa akin at usually hindi natatamaan. Tapos class, when you are donating blood, the gauge is usually 16 or 17 gauge. Yan. Usually the length of needles are 1 or 1.5 inches. For the butterfly infusion set, the needle is 1/2 to 3/4 inch. Yan. So, butterfly needle set class is good also for chemotherapy patients, for geriatric patients, yung mga matatanda na mahirap kuhanan. Yan. So, if you are using the evacuated tube system or the closed system, so meron tayong two-way needle. Yan. Meron tayong holder or adapter. Yan. Tapos yung evacuated tube. Yan. Sa arterial puncture class, so before performing arterial puncture, kung gagawa ka man, kung walang respiratory test, we first perform a modified Allen test. Yan. the person should be positive for modified Allen test to continue doing arterial puncture. For modified Allen's test class, we are checking for collateral circulation. Meaning, class, we are ensuring that there are two arteries that supplies blood to your hands, class. We have the radial artery, yung may malakas na pulso, yan, dito sa katapat ng thumb. Meron tayong ulnar artery, class, dun sa tapat ng pinky. Yan. So, these two artery, class, ano yan? Supplies blood to your hands. Ganyan. So, for modified Allen test, you're testing if there is good flow of blood between your radial and ulnar artery. Kasi nga, class, tutusukin mo yung radial artery eh. Paano kung hindi pala okay yung circulation sa ulnar? Eh di wala nang circulation sa hand mo. Pag wala palang tamang circulation sa ulnar artery tapos tinusok mo pa yung radial, eh di wala na yung kamay ng pasyente. Yan. So, a patient should be positive for modified Allen test to forgo arterial puncture. So, kailangan positive siya sa modified Allen test para mag-proceed ka sa arterial puncture. Yan. So, the common sites that we extract arterial puncture is the radial artery. Yan, yung mga pulso natin, radial artery, brachial artery here, dito, sa katapat ng pinky. Yan, femoral artery is sa may inguinal area, sa may singit. Yan. So, class, na-try ko ng mag-arterial puncture sa may singit, yan, sa may femoral artery. Because wala talaga. Wala sa brachial, wala sa radial, yan. Hirap kuhanan ng pasyente, ang rami ng IV. So, tinry ko yun, femoral artery. Literal talaga, 45 degrees ang tusok. But usually, arterial puncture class, 90 degrees ang tusok ng femoral artery. But normally, in radial artery class, it's only 30 to 45 degrees ang tusok ng arterial puncture. Yan, medyo mataas compared to your venipuncture. Yan. So, class, arterial puncture, we store after collection, we store it in ice. The usual anticoagulant that we use is heparin. Yan. Actually, sobrang konti lang, 0.5, or sometimes the syringe that we use is already lined with heparin. Meron siyang, on the walls of the syringe, meron na siyang heparin. Yan. So, sites of collection of venipuncture. So, the best vein talaga. So, this is your antecubital fossa. So, ang best na kinukuhanan natin is median cubital vein. So, that is the site wherein it is well anchored, it's big, it does not roll. Yan. So, cephalic vein. So, cephalic vein dito sa, sa may tapat ng thumb. Yan dito sa area to. So, cephalic vein, I recommend it when the person is slightly obese. Yan, okay ang cephalic vein. However, the disadvantage is it rolls. Yan, it's not that well anchored compared to yung median cubital vein. And we have basilic vein. So, your basilic vein, yung katapat ng pinky. Yan, dito sa area to. So, basilic vein is really not well anchored. It is the least anchored. So, ibig sabihin gumagalaw siya. It rolls. What else? Class, under it is the brachial artery. So, if you're not careful, you could puncture the brachial artery. Yan. So, class, may kakilala ako. So, yun, may pasyente nag-donate ng blood. So, imbis na basilic vein ang tinusok niya, brachial artery ang natusok niya. So, automatic class, since ang bilis po, ang laki nga ng gauge ng needle ng ng pag magdadonate ka ng blood. So, tinusok na dito, ang raming lumabas na arterial blood, nako, blue agad yung braso ng pasyente, cyanotic agad. So, pag medyo marami kang nakuhang arterial blood, guys, made-deoxygenate yung tissues. Yan, magkaka-hypoxia yung tissues. So, hindi talaga tayo kumukuha ng arterial sample. So, basilic vein is close to the brachial artery. What else? It is surrounded with nerves. Yan. So, ano pa? Veins on the antecubital fossa, ito. Wrist vein, yan. Ako, guys, okay sa akin matusukan sa wrist vein kasi mas malaki yung mga ugat ko dito, but we don't usually do that. Veins on the dorsal hand. So, we have to be careful when extracting in the dorsal hand kasi it's close to the bone. So, masakit 'to para sa pasyente, pati veins of the foot. 'Yan, masakit 'yun para sa pasyente, mas lalo na 'pag natamaan niyo yung buto class. Tapos what else? Um, Veins of the foot is not our priority for extraction, especially among diabetes mellitus patient. Yan, because usually, this diabetes mellitus patient, guys, have poor wound healing. Wag natin bigyan sila ng wound na matagal mag-heal. Okay? Yan. So, superficial veins of the hand. So, dapat mababaw lang to. Yan. Tapos, maliit yung needle na gagamitin mo. Yan. Tapos yung gauge, superficial veins of the foot. Yan, always check with the hospital policy. Yan, if it's allowed. Kasi nga, baka nag-inflict ka ng wound sa DM patient. Sites to avoid with. Yan, hindi ko nalagay ng photo to. So, burn scars, damage or occluded vein, yung mga baradong vein, yan. Hematoma, yan. So, the site was recently punctured, huwag mo natusukan doon. Edema, yan. If there is excess fluid under the tissue, huwag mo nakuhanan kasi nga tissue fluid lang makukuha mo. We have fistulas. So, class, patients who have dialysis, yan, who, in preparation of dialysis, gumagawa ng isang access site ang doctors. So, one of the access site for dialysis are fistulas. So, the doctors connect the vein and the artery to increase the blood flow and access. Yan, especially kung magdadialysis yung pasyente. So, ganyan, pinagdidikit nila. We call it fistulas, connection between or the joining of artery and vein to increase the blood flow. Yan. Or shunts. Yan. Ano daw, ang fistula class, mas matagal daw to since it was pinag-connect talaga eh. Mas matagal it will last longer. However, class, itong mga shunts, yan. So, there are hollow or passage between the arteries and veins. So, mas madali daw tong masira. Yan, it would not last long. Yan, depende sa need class ng pasyente. Depende sa recommendation ng doktor kung fistula ba ang kailangan or shunt. So, hindi tayo nakikialam dito, class. Kayo tutusok dito. Yan. Especially, yan, sometimes when I was an intern, they call interns to go to the dialysis center and extract blood. So, I was happy that the nurses instruct me na, ma'am, don't extract here because there is a fistula. Ma'am, don't extract here because there's a shunt. Yan. Wait naman sila dun. And you can ask the patient. Yan. Alam din naman nila. We have, arteries, femoral veins, or varicose. Naku, class, ito talaga, kahit ang lalaki, yan, huwag kayo tutusok dyan kasi wala. Yan, walang lalabas. Yan. It's unreliable. Mastectomy patient. So, yon class. So, when there is the removal of breast. So, do not extract on the site of mastectomy. So, kung dito, side, huwag kayong mag-extract dyan because they will be prone to lymph stasis. Yan. So, if two breasts are removed daw, draw from the back of the hand on the dorsal area of the hand. So, class, so first part is position your patient properly. Yan, make sure they are comfortable. Tapos, position yourself properly rin. Make sure you're also comfortable. So, yun, class, practice phlebotomy and make sure, watch out for your posture. Kasi isipin mo, kung mag-phlebotomy ka ng ilang pasyente a day, tapos yung posture mo mali, or very uncomfortable, then class, ikaw rin yung kawawa by the end of the day. Okay, so position your patient well, position yourself also as well. Tourniquet application, so we put it 3 to 4 inches above the site of puncture. Tapos, we only place it less than 1 minute. Yan, site selection. So, class, the right way to clean daw the area already is not circular, pero yung pag ganun na. Yan, parang sa blood collection. So, yan, you clean it, you scrub it. And site antiseptic technique, then site selection, needle insertion. So in venipuncture, so the needle insertion is 15 to 30 degrees only. Yan. So pag arterial puncture, 30 to 45 degrees Celsius. So class, watch out. So laging bevel up. Tapos watch out where the angle of your needle. Kasi nga, yun, pwedeng walang lalabas dahil sa angle ng needle mo. So you could adjust. Yan. The angle of your needle. Yan. So kumuha siya sa median cubital vein. So fill the tube correctly. Yan. Place your vacutainer properly. Yan. So make sure, class, your vacutainer is not expired and kompleto yung vacuum sa loob. So class, we have complications for venipuncture. So immediate local complication are hematoma. Yan. So hematoma is the accumulation of blood under your tissue. Hemoconcentration and syncope or fainting. So once syncope or fainting happen, so allow the patient rest or allow the patient to put stop. Una, stop the phlebotomy immediately, tanggalin ang needle, tapos allow them to rest their head between their knees or between their thighs para bumalik yung circulation ng blood. Kung pwede, kung hindi pwedeng gawin yon, itaas yung paa. Yan, late or local complication, thrombosis, clotting, formation of clot, yan, thrombophlebitis, so inflammation of the blood vessel or the vein with clotting, delayed general complication, HIV, hepatitis B, hepatitis C. So class, yun. So cardinal sin nga daw, sabi ng teacher ko, ang hemolysis. So once your serum blood, you collected your whole blood, you place it in a red top, centrifuge mo, dapat ang lalabas 1. Ganyan dapat ka-golden glass yung serum mo. So 2, 3, 4. So there, 2 has slight hemolysis, 3 and 4 have markedly increased hemolysis. So kailangan ulitin ang hemolysis. Pag hemolyze ang sample, you need to repeat that. Yan. Hemolysis may be due to tourniquet application, moisture, contamination, small bore, yung disadvantage naman ng choosing the smallest bore, very prone ka sa hemolysis, frothing of sample. So pag lumabas yung dugo sa needle mo or sa two-way needle mo na may bubbles, class, nako, most probably hemolyze yan. Expelling of blood through the needle. So if you're releasing blood through the needle, pwede ma-hemolyze yan, and excessive mixing. So guys, dapat ang tamang anggulo yan sa pagtusok is ganito. So 15 to 30 degrees, correct insertion wherein the blood flows freely into the needle. However, if the bevel is in your vein, walang lalabas dyan na blood flow. Or you've inserted the needle, inserted too far, so iatras mo na lang. Bevel on vein, lower on the wall, so hindi naka-bevel up. Notice, yun. Nasa wall rin, so wala ring lumalabas. So check nyo before inserting the needle, always check if the bevel is up. Yan, need partial. So your needle is only partially inserted. So naghematoma, naglilik yung blood sa may tissue, or the tissue collapse. Yan, especially if it's really small or the needle is so small, the vein is so small, or the needle is too big, yan, it could collapse the vessel. Yan. So class, specimen preparation. So when we say whole blood, simply collect a blood sample in a tube with anticoagulant. Yan, whole blood na agad yon. So kumuha ka ng lavender top tube. Yan, nag-draw ka ng blood. So ang tawag doon sa blood na nasa lavender top is a whole blood. Yan. So, dapat may anticoagulant yung tube, ha? So, whole blood yon. Pero kung nasa red top siya, class, hindi yun whole blood. Pag may anticoagulant, yun tawag sa kanya whole blood. So, once you centrifuge it, so your whole blood was divided into cells and plasma. Ang tawag dyan. So class, when you use anticoagulated blood and you centrifuge it, ang lalabas, plasma. But once you place your blood in a red tube or a gold tube na may na may clotting na may activated activator, yan, clotting activator, yan. So pag hiniwalay mo yon, clotted blood and serum ang lalabas. Yan. So, serum preparation. So, your serum should be separated from cells within 2 hours. Yan. So, unless collected in a gel separator tube. Yan. So, class, if you want to prepare serum, so you could use red top, you could use SST, yan, or gel separator tube, or serum separator tube, yan. So, you have to watch out kasi yung rate of glycolysis, yung breakdown ng glucose nyo at room temperature, 7 milligrams per DL siya. So, per hour, I think. And at ref temperature, 2 milligrams per DL. So, class, allow the red top tubes to clot sufficiently for 20 to 30 minutes. Yan. Usually, if it's a gold top, mabilis lang naman mag-clot. Centrifuge it for about 15 minutes. Yan. Keep tubes capped during centrifugation. Lipemic specimen could be ultracentrifuge. Yan. So, what's the difference between plasma and serum? So, class, plasma, so the blood, the previous blood has anticoagulants. Yung serum, it has no anticoagulants. Yan. So, since plasma, there was no coagulation that happened, the clotting factors are still intact. Yan. Here, in serum, there's no more clotting factors. Yan. So, if you want to test the level of fibrinogen, plasma dapat. So, light blue tube. Yan. Given to patients lacking blood cells used for diagnosis. Yan. So, serum preparation, ito yung mga tube natin, red. Yan. So, pag yung red, may silica. So, clot activator to. Pag yellow or gray, yan, orange rin, may thrombin yung clot activator niya. So, class lahat to magre-result sa serum. Red or gray, yan, parang tiger top, tube, gold, yan, pang serum separator. Meron namang clot activator. So, yung red pag glass, walang additive. Pag yung red, plastic siya, may silica siya. This is also a clot activator. Yung yellow or gray, ito, and orange, it has thrombin. So, this activates clotting. And red or gray and gold, yan, meron siyang clot activator separation gel or SST tube, serum separator tube. So, usually, they're used for chemistry and serology. Yan. If you want to test for antibodies, pwede ang serum. Next class, we have your EDTA. So, your ethylene diamine tetraacetic acid. So, ano ang mga kulay ng may EDTA? So, ang pinakasikat class is lavender, meron ring pink, white, at saka tan. Yan. So, tinatanong rin to sa exam class. So, tan is lead testing. So, EDTA rin ang laman nun, ha? Pag molecular diagnostics, pwedeng white. Yan. Pag blood bank, pink, usually blood bank. And class lavender, if you want to do complete blood count, platelet count, class lavender tayo. Huwag kakalimutan, ha? So, yun. So, if you want to do hematologic cell count, you want to see the size, the shape of your WBCs, your red blood cells, use EDTA. Don't forget that, okay? It's not for coagulation test. So, ang coagulation test is for your light blue tubes. Yan. So, class, it chelates calcium or it binds calcium. So, to prevent clotting. So, calcium is very involved in clotting. So, tinatanggal niya yun. Yan. Para hindi mag-clot. So, it's an anticoagulant. Same with sodium citrate and potassium oxalate. So, pag narinig nyo yung citrate at oxalate, nagkekelate rin sila ng calcium. So, class, within 2 hours, so pag gumawa ka ng smear within 2 hours, maganda pa yung morphology ng cells. But class, after 2 hours, nag-shrink na yung cell. So, you have to do your blood smear fast. Yan. So, we have 3 forms of EDTA. So, disodium EDTA, dipotassium EDTA, tripotassium EDTA. So, dun tayo sa K2 EDTA, yung spray dried. Yan. Dati tinatawag na lang Versin, yun, sequestrin. We also have your EDTA is prone to have platelet satellitism. Yan. So, ang effect nito class, it could decrease the number of platelet. So, ito yung isang disadvantage ng EDTA. It causes the platelet to surround a WBC. And its effect is decreased platelet count. Yan. Excessive EDTA will damage your blood cells causing shrinkage. So, pag excess yung EDTA at short draw ka lang, so ang effect niya is it will decrease your hematocrit count, your blood volume, yan, your red blood cell, packed cell volume, hematocrit or packed cell volume, and ESR results, erythrocyte sedimentation rate. Next class is your sodium citrate. Yan. So guys, your sodium citrate, we have light blue and black. Yan. So when you will find a black tube, the anticoagulant there is sodium citrate. Class, black tubes are used for erythrocyte sedimentation rate. So class, the ratio for the blood to anticoagulant is 1:4. So every 1 part of blood, so 4 parts of sodium citrate. Pag 4 parts siya, pang ESR siya. But if it is its ratio is 1:9, so 1 part blood and 9 parts anticoagulant. So it's for coagulation tests. Yan. Yung PT, APTT, yan. Prothrombin time, activated partial prothrombin time. So, bang light blue yun, okay? Sodium citrate ang laman nun. So, we have also heparin. Yan. So, heparin, pag nasa royal blue, heparin yon. It's for toxicology, trace elements, yan. So, tan ren class, huwag kakalimutan lead testing. So, either EDTA or heparin. Yan, pag glass. And light blue or green. Yan. Pag light green or green-black class, may gel yon. So, usually, ito yung ginagamit natin, yung typical na green lang. So, may heparin. So, for chemistry. So, class, heparin. So, it acts as anticoagulant by enhancing or accelerating the action of antithrombin 3. Yan. So, your antithrombin 3 prevents the creation of thrombin. That's why there's no clotting. Yan. It prevents the formation of fibrin. Its use is for osmotic fragility chemistry test class, calcium test, potassium tests. We don't use potassium in serum because potassium is released when platelet clots. Yan. So, upon the action of clotting, tumataas ang potassium. So, better heparin na lang for potassium. It's not for blood film preparation. So, if you want to do a blood film, EDTA po ang gamitin nyo, okay? Because it will produce a bluish background in Romanowski stain. So, pag bluish background, dahil heparin yung ginamit na anticoagulant. So, don't use that. Use EDTA. It's not for coagulation tests. Yan. So, yan, we have gray. So, gray it contains sodium fluoride or lithium iodoacetate. So, it's an anti-glycolytic agent. It prevents glycolysis. So, for glucose testing, we have yellow tube for culture. So, ang laman niya is sodium polyanethol sulfonate. So, your SPS class, it prevents the activation of complement lysis or complement cascade. It inactivates certain antibiotics, yan, and it reduces chemotaxis. It reduces phagocytosis, yan. And yan, acid citrate dextrose for blood banking. Yan. So class, ayun, the rationale. So ito yung order of draw natin. Blood culture muna, coagulation tubes muna. So una natin pinupuno ay blood culture tube is to minimize a chance of microbial contamination. Coagulation tube ang next because if there is a runoff of other anticoagulants, yung sodium citrate, pag nalagyan ng ibang anticoagulant, it could affect the coagulation test. Coagulation test class are very time sensitive because usually we measure the time of clotting. Yan. So kung nadagdagan siya ng anticoagulant from a runoff, edi it could affect the results. Yan. Next is glass non-additive tube. So usually red. Tapos kung may yung may gel SST ka, yan. Yung may serum separator gel ka. Next, tapos heparin and EDTA tubes, oxalate, then fluoride tubes. Yan. Stop, light red, stay put, green light, go. Oh, whatever. Okay. Guys, thanks for listening. I'll see you again.